La leçon que je vais partager parle des soins de santé.
The lesson that I will share with you is on healthcare. We have two texts, Luke chapter 8, verses 40 through 56, and Luke chapter 10, verses 25 through 37. These texts talk about various forms of healing. Healing as the direct result of intervention by Jesus, and a healing that occurred because of the help given by the Good Samaritan. In these texts, it is clear that God blesses the initiatives of humankind. Jairus invites Jesus to heal his child, and Jesus goes to the home to do it. There is also a woman who did not invite Jesus, but she touched his clothes. Jesus saw her faith and healed her. God cooperates with humankind and blesses our good initiatives. In fact, God cannot do anything in this world without people. It is not that God isn't powerful, but God has chosen to collaborate with humankind. If God's collaborators do nothing, then God is seen as doing nothing because this is in God's plan. It is important to remember that when Jesus was here on earth, he performed physical healing. It is true that Jesus announced the good news. Those who believed in Jesus were not left ill, they were healed. Good health care is a serious problem in the Congo. In a country where the majority of the people have only one meal a day, it is normal that there is a lot of sickness. Going to a major hospital has become a luxury for most Congolese. There are many who don't get adequate medical treatment simply because they are transferred to another doctor or hospital and they don't have transportation to get there. Today, women work a lot more than they did in the past because of the economic crisis in the country, but on the contrary, they don't get enough to eat. As a result, they are often sick. This also includes the children. There are children who are ill because they don't get food, and they say the same thing every day, I am hungry. A sentence, my stomach is full, is disappearing from their vocabulary. A balanced meal does not exist in the language of many families. We find that there is a lot of illness because of poverty. People work very hard. Giving birth is becoming more and more difficult. The state of the roads prevents many people from getting to health centers, which are very few and not conveniently located. There are places where medicine is very expensive and transportation costs a lot more here than in many other countries. All the medicine comes in from the capital of Kinshasa. When it reaches the towns in the interior of the country for transfer to the villages, and the cost of transportation has been added to the price, the cost is beyond the reach of the average person. This means that many people die without having the opportunity to meet with a doctor. The lifespan of a person in the Congo varies between the ages of 45 and 50. It is by the grace of God that some people live beyond 50 years of age. We see a lot of negligence in some hospitals because the doctors are forced to leave the hospitals and look for more money and better paying jobs elsewhere. There are some who have their private practice and they take care of their patients with a lot of love. However, one must say that they are able to do so because it is very expensive to visit them. We know that there are people who die from natural causes, but there are many others who die because they do not have the means to obtain good health care. Yes, many try various forms of self-treatment. Others will go to traditional practitioners. Some people treat themselves with herbs that are grown here. The problem is that there are not enough studies done on the use of these herbs. Since one does not completely understand what these herbs can do or the exact dosages required, there are many more negative consequences than there are positive consequences in using them. Amen.